Hey guys, welcome to Indian on Mounjaro. I am sorry I am late, but this is me. And the great news is that from 5XL, I have gone down to 3XL. As you can see, my stomach and my other portions have greatly reduced, but I have lost barely 8 to 9 kgs and I keep gaining it back because of medication and eating randomly. For the past 2 3 weeks, I have been feeling very hungry. My cravings are back, and the appetite suppression is not that good. But I tried to be on the 5 mg dose itself so that I can make the best use of the whatever medicine is there, because going high up is very easy, but then coming back down is a little harder. So I did not want to rush into getting to a higher dose. But today I am jumping on from 5 mg to 7.5 mg. I was on 2.5 mg for the first 6 weeks and I lost around 3 kgs. Then I was on 5 mg where I lost 1 or 2 kgs and then my weight loss had stopped. And then slowly again the weight loss started happening, and currently I am the lowest I've been was last week in 97.8 or so. But this week I've gained weight again and again. And this morning I was actually 99.2. I think it's my medicines that make me gain weight. I have bruxism, so sometimes I have to take SOS painkillers, which cause a lot of water retention. So that is there. Plus, I have been eating out. I have been eating out. I've had cravings. Just last night, I had samosa and pav for dinner, which is absolutely wrong on my part. So the weight gain is justified. It is definitely water weight, but it is weight gain nonetheless, and I will have to lose it. And with overall symptoms have almost vanished, my constipation is not there anymore. So I realized that the medicine dose is not very effective on me right now. So I have been on 5 mg, I think, for 12 to 16 weeks. I think I have actually lost count of the number of weeks that I am on. I will have to calculate that. So I will check that, and I have been on 5 mg for at least 2 3 months minimum, and maybe even 4 months. And now I am titrating up with the help of my Mounjaro Quick Pen. A lot of you had reached out to me understanding more about the Quick Pen. I understand completely. The Quick Pen is a little confusing. Uh, why will I open the door? So, yeah, so the quick pen is a little confusing. I've also done my shot for the first time last week. Today is the second time that I will be taking my quick pen dose. So I will try to explain it better. Last week I had opened the pack on live video, and I had not studied it before. And since I was also taking it for the first time, it did look a little scary, but it's not. It's exactly the same needle that you get in the syringe, and the size of the needle for the quick pen is also similar. So it isn't really painful, but we are going to try to take it. Another important aspect of the quick pen, let's just talk about the quick pen today. Here is the pack of quick pen. I put it in my fridge all the time, and I take it out only when I have to put an injection or administer the dose, which is I took it out last week, and then again I've taken it out this week. Okay, so this is what the pack looks like. Now, this is the quick pen. It's a 10 mg pen, but I have taken a 0.5 mg dose out of it. So it works on the click system. So you taking this nib out, this is what it looks like. I will try not to touch this portion because it will heat up the medicine, which I don't want. Now, if you see, there is reading over here. Okay, I have already taken one dose, so it goes to 0. Okay, and now I want to take 7.5 mg out of a 10 mg dose. So this, like this, is one click, and there are 60 clicks from 0 to 1, that one dose. So if there are 60 clicks there, you will have to do a little mathematics. So 60 clicks there, so 45 clicks will give me a 7.5 dose. Yeah, I mean, if there are 60 clicks, then 15 clicks will give you 2.5 mg, 30 clicks will give you 5 mg, 45 doses clicks will give you 7.5 mg, and full 60 clicks or from 0 to 1 will give you 10 mg, because this is a 10 mg pen. So I want to titrate up my dose um, to 45 clicks. So I am going to 1 and then I will turn back 15, because it is easier to count back 15 than to count 45 clicks this way. So I'll show to you this way. I hope it's visible. So I am going to, this is 1. Okay. Can you see? Yeah. See, this is 1. Now I will count back 15 clicks to get a 7.5 mg dose. Okay. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. Now this is my 7.5 mg dose in the Mounjaro pen. My dose is ready, and I will put a needle here, which is a fresh sterile needle. I will put the needle here and I will use this as an injection. Just say I will have to press it like this, and it will go in completely and administer the dose in my stomach. So let's go. This is a pack of needles that you have to buy separately. This is the name. Sorry, this is the name, I think. Yeah, 32G, 0.23 mm. Okay, and it has, Remali Praveen says that I should keep a mark there so I don't need to count every time. Yeah, that's a good idea. I will do that one time, but I don't mind counting either. But thank you for your advice. I'll think about it. So these are the needles that come along with it. Okay, it's a pack of 5. I have used one. This is my second piece. It has a covering here, which I'm going to remove and put on my needle. So let's do this nice and easy. So I'll just remove this, and I will screw it on top. Okay, it is nice and tight. My dose is ready. I only have to remove these caps and insert it now. So I'm going to take a cotton swab dipped in alcohol or spirit to clean the spot where I'm going to take my injection today. So here is my cotton. Here is the alcohol or spirit or whatever you want to call it. It's available on Amazon, or you can borrow a little bit from somebody in the hospital. A lot of you wanted to know if it is easy to administer the dose on your own. Then yes, it is. In fact, it's very difficult to go to the clinic. It's very difficult to go to the clinic every single time to get a dose. So it is better if you learn to do it on your own, and you will be able to take this dose and administer the medicine discreetly without anyone knowing. And it's not hard. Usually, we are always told that injections are to be done in the hospital, but this kind of injection is called a subcutaneous injection or a sub-Q. And just a little bit of research should help you administer the dose on your own. I do it for myself. from the very first dose. I never went to any clinic, and it's easy to do. So you should try too. So I'll just put this down for a moment because I'm scared that I will drop it. I'm going to clean the site. I don't show my face. Why do I not show my face? Because I don't want to be judged by people that, this person lost weight because of Mounjaro and she was lazy and she was this and she was that, which is not true. I have done a lot of diets. I have done a lot of exercise for years and years and years, for at least 7 years. I have been doing a lot of things and nothing helped. So now I am on Mounjaro on the recommendation of my doctor. I am not a doctor or a nurse. I am taking this medicine for myself. I learned to put injection for myself. A lot of people do that with insulin medicines also, and there are many other medicines also, like I don't know what, but people take them on their own with the help of a syringe, and it's doable. So let's do that. So here is the cotton swab. I'm going to clean the area, and let's administer the dose this week. Okay, here I put it. Okay. I also hide my face because I have to show my belly and I'm not very okay with that. So the shot has to be 4 inches at least away from the navel. And every week switch sides. So last week I took it here. This week I'm taking it here. So I'm just going to clean the spot. I'm going to remove this cap. There is one more cap inside. I'm removing that as well. So this is how thin or thick the needle is, which is very fine. I'm just going to inject a little bit to make sure there are no air bubbles inside. There is some fluid coming out. Can you see? There's some liquid coming out, which is great. So my syringe is ready. Okay. I'm going to try to take this. Just hold your skin, insert, inject. And it's done. This is done. My dose is done. Okay. It does not hurt. It just makes you a little nervous until you get used to this device, because I have never used it before, so I did not know how to use it. But now I'm a little more confident. See, the plunger has also moved up to here, which means more and more of the medicine is getting used up. Oh, now I know what this person said. Remali Praveen, I know what he said. So every time I rotate this, it goes to 1. So if I mark on 0.75 every time, I will get it. Oh, now I get it. Very, very good idea, Remali Praveen. I will use that. Now this needle is useless. I have to throw it away. So I am going to take this out. I'm screwing it open. Okay. I'm going to discard this. I will throw it away later. And I will put the cap back on. And it is good to use next week. And I'll just put this back in here, and then it goes into my fridge, and that is it. That's the dose, guys. And if you have any questions related to Mounjaro use in India, or if there's anything at all that you want to ask about Mounjaro, please feel free to drop a message. Please continue to be in discussion with me. A lot of you have been reaching out to me on Instagram. My ID is same on Instagram as well. It's Indian on Mounjaro. So yeah, get in touch with me if you have any questions, if there's anything you want to ask. And I'm really happy with the way things are moving for me. My weight isn't much, but I have lost 2 full sizes, which says a lot about the effectiveness of this medicine. And I'm really happy that this is happening for me. Um, in the meantime, while my dose is up, I hope that this week things get better and my weight gets moving and I am able to do better. Please reach out to me on Instagram. Please follow me on Instagram, Indian on Mounjaro. Please subscribe to my channel here and stay tuned. I'll see you next week. Next week, I'm going to administer my dose on a Thursday because upcoming 2 3 weeks I have to travel and I want to take my doses on Thursdays instead of Fridays. So I'm going to move one day up. Um, yeah, if there are any more questions, anything else that you need to reach out to me for, please do so. I love you guys. Thank you so much for each and everyone who's been messaging me, who's been talking to me, because that really keeps me going and it really makes me very happy that we are building a community where we are able to track our progress and talk to each other and feel good about our progress. A lot of you have had tremendous weight loss in the very first few weeks, and that is just magical. I'm so proud of you. I'm so happy to hear that for you. But for me, maybe a higher dose is going to be effective because I'm not losing much weight, but I'm losing inches, so I'll take the win. Until then, see you next time. Lovely knowing you, lovely meeting you. Bye bye. Oh, don't forget to subscribe to my channels, okay? Please follow me on Instagram and subscribe to my channel on YouTube.